Nitrates work by being converted into nitric oxide, and nitric oxide is a systemic vasodilator. And so when patients experience angina, which is ischemic chest pain, they're having vasospasm in their coronary arteries, which is reducing blood flow to the heart tissue. They take their GTN, and that restores blood flow by vasodilating the coronary arteries. Now, as well as coronary arteries, nitrates can have vasodilating effects on the systemic arteries and veins, which works essentially to reduce the workload on the heart, and that will be covered in slightly more detail towards the end of the video. Now let's have a quick look at how the effects that nitrates have on vascular smooth muscle cells and how that leads to vasodilatation. So nitrates are first converted into nitric oxide, and then they act on an enzyme in vascular smooth muscle cells called guanylyl cyclase, and that produces a molecule called cyclic GMP, and cyclic GMP acts on calcium channels to reduce calcium coming into the cell. And calcium is important because it binds to calmodulin, which is involved in muscle contraction. So it essentially causes smooth muscle cell relaxation, and as you can see, if you get relaxation of the smooth muscle cell, that causes vasodilatation. And so that's how nitrates cause vasodilatation. So let's look at how nitrates work on specific blood vessels. So we've got coronary arteries here, and we've got our thrombus in our coronary artery, and we've got coronary vasospasm around that thrombus, which is reducing blood flow through the coronary artery. And reduced blood flow leads to ischemia because the heart tissue isn't being perfused, it's not receiving enough oxygen, and that causes our ischemic chest pain. So if a patient comes and takes nitrates, GTN spray, that causes vasodilatation of the coronary arteries. And so you can see, if you vasodilate that coronary artery around that thrombus, the blood flow is going to be restored and you get a resolution of ischemic chest pain. In terms of systemic effects of nitrates, if we have vasodilatation occurring in the veins, we get blood pooling in the veins, and that has an effect on the heart by reducing the filling pressure in the right ventricle, and that's also known as preload. So if we reduce the preload, that in turn reduces the wall tension within the myocardium of the ventricles, and that reduces myocardial oxygen demand. And the reason that reducing the oxygen demand of the heart tissue is a good thing is because if you remember that ischemia is where the heart tissue isn't receiving enough oxygen, if you reduce the amount of oxygen that the heart actually needs in the first place, then it's less likely to ever become ischemic. And it's for this reason that, as well as the resolution of ischemic chest pain in the acute setting, nitrates can also be used to prevent chest pain occurring in the first place. On the arterial side, if we get vasodilatation of the arteries, we get reduced blood pressure, and so we get reduced afterload. So we get reduced resistance to when the left ventricle is trying to eject blood, and that reduces the work of the left ventricle, and so we get reduced oxygen demand in that way. So that was just a very quick summary of how nitrates actually work, and at the minute they're looking like a really good medication for the management and the prophylaxis of ischemic chest pain. However, like all medications, there are some side effects to nitrates. We don't just get vasodilatation in the vessels that we want, we also get vasodilatation in the cerebral vessels, and that can cause slightly raised intracranial pressures as the vessels expand, and so patients can present with headache. Another side effect, of course, is the fact that these medications lower your blood pressure, and if someone's already got low blood pressure, then they can lower it a bit too much, and so they can present with postural hypotension, or in severe cases they can actually present as falls.